Okay guys, so today I'm going to talk about something. It's going to feel a little esoteric, but I promise you I will bring you home. We're going to talk about art and how that interacts and influences my perspective, my philosophy on facial plastic surgery. Some of you may know, some of you don't. I'm a portrait artist and I have been since I was basically a child. I've always been fascinated with the human face, drawing, painting, and I've been a portrait artist for many, many years. So if you want to actually check out some of my work, you can go to carltruesdale.com, just in case you didn't believe me. But I've basically always been fascinated by the human face. As far back as I can remember, I can see photos and drawings that I was drawing of people's faces. And as much as people wanted me to kind of look at landscapes and things like that, I always kept coming back to the human face. Years later, as a facial plastic surgeon, I use this and those concepts every day. But let me walk you through my own journey with art. So both of my parents are actually artists. My dad's a scientist, but I remember looking at paintings that my dad would put up on the wall. Even as a child, I remember looking at this one painting in particular. It was of a family, a black family. They were all naked and they were floating in space. And there was two parents, the black man with a big afro, a woman with an afro, and a baby that she was holding. And I thought, like, that's so cool. Like, my dad painted that and it looks like a real person. Those kind of things like kind of kept with me, and just always being around creativity. My mom always going to Joann Fabric, and I would just be there for, felt like hours, probably wasn't, but it could have been, just wandering around, looking through the different aisles, you know, the knitting needles and different booklets that, you know, how to knit, how to crochet, or maybe flowers and floral design, or maybe arts and crafts, or maybe, you know, a drawing set. I basically tested and sampled all of the different aspects because I always loved that creation. So as far back as I can remember, I remember looking at these things and looking at the world as basically an easel and a canvas to paint and to kind of craft. The first time I ever remember really thinking about drawing, I remember it was Christmas time, and at my local mall, this is back when malls were a thing, there was someone there next to the big Christmas tree, and they were doing portraits. And you could go online and have this woman draw your portrait with charcoal. She had her portfolio out, and I remember seeing like all these famous people, Angelina Jolie, and you know, all these people, and they just looked so real. And I saw her hand, you know, with the charcoal and just moving across the paper and really capturing people's essence. So I begged my mom, begged her, please, can I get one of these? And I think I wanted it, one, to kind of capture myself, but try to study it at home. Like, how can I do this? And she's literally taking this blank piece of paper and she's putting down charcoal, and it looks like people, and the detail and the expression, it was just so cool. So I did. I got my mom to buy me one. I remember taking it home and I put it up on my wall in my room. And I remember just staring at it, trying to figure out, how did she make the texture of my sweater? How did she make one side of my face look a little bit smoother and the other side? And then I dove in to the world of portrait work. Every Sunday after church, my parents we would usually go out to somewhere to eat with the church. And one day, I remember we went to Old Country Buffet. You may be aware of it. I don't even know if those are still around. But right next door was a Barnes & Noble. Barnes & Noble used to be my jam. I used to spend hours and hours and hours. Literally, I would have my parents drop me off at Barnes & Noble. I would sample all different sections in the store, but one I always loved going to was the art section. When I realized that there were books that could teach you how to draw, I was hooked. So I remember getting my first book. I probably was, 10 years old, on basically how to capture what you're seeing in front of you and translating that into paper. You know, you start off by creating little quadrants and trying to figure out how different lines and shape translate over. I got pretty good. I was able to pretty much recreate very quickly what I saw with my eye to paper, and it just continued. And I got better and better and better. And a lot of this was just self-taught. I just saw what was in the book. I saw the little notes that they would make, and then I would draw everything. Literally everything around me became something to draw, to try to create. So if I was sitting in the car on the way to see my grandmother, be in the backseat of the car, pencil in hand, just drawing. And, always came back to the human face. Now, years later, when I became a doctor, this became, really interesting because I would use my ability to draw and kind of visually see what I liked, translate that to basically learn and reinforce what I was reading and studying. I found that if I drew the anatomy that I studied, I would almost instantly be able to capture it, and it would just be locked into my memory. It's funny because as you're an artist, you start learning concepts of the human form, what looks normal, what looks natural, what's kind of standard between certain ethnicities, what things, create expression, frowns, wrinkles, creases, how big is the eye, what's the ratio of the pupil when someone is afraid, does that get bigger or smaller, what does the lip look like? Years later, I started understanding that all of those things have anatomic reasons, right? All those little concepts that I learned as an artist, I didn't know where they were coming from. They came from the human form. The more and more I studied anatomy, the better I got at art. And the better I got at art, the better I became as an anatomist. And so the concept of, ears always have a little bit more of a red. The reason why is the skin of the earlobe of the ear is very translucent, very thin, and the ear is very vascular. So you're seeing the blood vessels underneath, right? There's a reason for all of these little things. And as I go back in my mind, reviewing my relationship with art, all of these things became important as I became a facial plastic surgeon. And I can go through various examples. When I first started looking at how to draw a nose, it's a very standard, basic anatomy of what is a nose. But later I would understand, there's different subunits of the nose. And then as I became a head and neck surgeon, those subunits are very important for reconstruction because we have to obey them. And there are certain things that we can do to repair defects in certain subunits. And if we don't repair them the right way, then people look different and they look altered. And if we respect those things, then people look more restored. And so all of these things kept coming into play and reinforcing basically by outcomes. Well, what does that mean for today? Well, today, every day people come and see me and they want to look like the best version of themselves. And those small nuanced details, the ideas and those forms that I've been basically learning since I was a young child really allow me to make the small micro decisions that have allowed me to produce these really natural, beautiful results. People talk about, plastic surgery is art. It is so true because I have a decision with every single patient, how much skin I remove and to what degree I move the skin. Is it a millimeter? Is it 2? Is it 3? It could be a lot, right? What technique I use. The way I kind of think about my journey today is that it's been a lifelong journey and the discovery of art and science. And now it's been channeled through my career as a facial plastic surgeon. And I'm so blessed I get to help people every day with this art. And so unlike a painter, you can spend a lifetime painting a Sistine Chapel. I can create these masterpieces. I can touch these lives every single day. It can be a new canvas. And that's how I think of the face, as a canvas or a block of stone. Or maybe it's been a sculpture already been created and you're just restoring it. The analogy I give, some of my rhinoplasty patients, when you're doing a nose job, what you're doing is you're changing the way that shape looks. You have three options. Either you can remove structure, you can add structure, or you can change the structure that's there. This is similar to when you are basically working with clay. You can take the clay that's there and you can add some clay to build it, right? That might be adding a structural graft. That might be adding some fat or some tissue to camouflage something. You can remove something, like removing a hump, a bone, or maybe that cartilage is just a little too excessive, right? You can shape what's there. You can make a tip that's more rounded by just putting a couple of sutures, change the resting angle and make a tip that's bulbous, really contoured and have a lot of definition. And so it's really those same concepts of art get translated to today. Right now, I am in the middle of, looking at trying to expand my practice and thinking about hiring an associate physician. The more and more I think about, I've studied art, the great masters like Leonardo. There's so many masters, right? And a lot of that focuses on how to translate what the artist sees to their mentee, right? These great masters, they would have teams of people working under them. And if you look at, history, if you go to these great museums, these large pieces of work weren't just created by the one person who's credited, right? It's the whole team that helped create that. But it's them translating their vision to the actual final and finished product. If I can do anything, a part of my journey in medicine and facial plastic surgery, it's to translate some of the techniques that I've learned to another surgeon. I've always loved to teach and to raise the bar of plastic surgery as I see it today, the standard of care. It's funny, Picasso has a very, very famous phrase. When he was young, he was very gifted and he was able to paint almost photorealistically. And he said something to the effect of, it took me a lifetime to learn to paint as a child. And, obviously he's famous for his abstract work. But if you look at, some of the work that he produced when he was very, very young, it looks amazing. And some would say, oh my God, that's more advanced than what he produced when he was much older, right? Kind of cubic faces that are very colorful and bright and abstract. People would look to some degree and say, well, what he started off making was amazing. I think the concept there is you start off learning the rules. You start off learning the anatomy. You start off learning what the normal is, or variations or variants of normal. Then you can use your own jazz to try to create and shape the world in which you want it to be. I have to translate what the patient wants through the prism of what I can do and what I think looks good. But the only way I could do that is if I had a very strong fundamentals in anatomy, in the medicine and the techniques that you learn throughout medical school, residency, surgical fellowship, and then eventually practice. It's a journey. And every day I go to the operating room, I am crafting not paper and oil, graphite, charcoal, but literally flesh and blood. It translates to the most beautiful gift and most beautiful art that I think exists, which is the human face, the human form. All of those years ago, when I was walking through my local mall and looking at portraits being drawn, all of that now has helped push me and shape me into the plastic surgeon that has the ability and the gift to touch millions of people across the world. It's so funny because when people allow me to post, it feels so great because it's like me sharing my purpose with the world. You can write a beautiful song, but if no one hears it, is it as good? Has it fulfilled its purpose? That's kind of a philosophical question. I don't know the answer. But to me, the purpose is to touch people. Obviously, it is for the person, it is for the patient, but sharing it and allowing other people to understand that it's not just about vanity, it's not just about what we look like on the outside, but how it affects how our face and how other people perceive our face and how we perceive our face really manifests our entire lives, our confidence, all of the things that happen internally, right? Matching that person on the inside with the outside through plastic surgery, in my mind, is so beautiful. And it is the most and highest translation, embodiment of art. And I am just so blessed that I get to be a part of being an artist, a creator every single day. I could go on and on about how I think about art and the different tools that I use and how they literally translate to concepts that I've learned on paper. All this to be said, we all have something to give the world. I feel like one of my great purposes is to be a facial plastic surgeon. In my mind, that is a translation of art and medicine to affect people's faces and make them happy. So hopefully you've enjoyed my long spiel about plastic surgery and art and my own personal journey. I literally could write a book about this. Maybe I will one day. But if you guys are interested in seeing some of my work, definitely follow my link subscribe, click for more. You'll be able to see it all the time. See you guys soon.